Students, good morning to all of you. As you all are aware that due to the COVID-19, you are all at home. So, in this duration, to guide you all, we have started the online pharmacology classes. In this chain, today we are starting the topic diuretic, and this is the first lecture of the diuretic. The diuretics are the drugs which increases or causes net loss of sodium and water in urine. It means they increase the urine volume. In simple words, they are used in many diseases and clinical conditions. We will learn or discuss in this lecture. But before talking about the diuretic drugs, you should have a brief knowledge about the urine formation and the parts of nephron. So, as you have all learned in physiology that these are the different parts of nephrons. The first part of nephron is glomerulus. You all know that around 180 liter of filtrate is filtered from the glomerulus in one day. And most of the portion is again reabsorbed from the different parts of the nephron. Only the net 1.5 liter urine per day is excreted from the body. So in this reabsorption, the first part, the proximal tubule, plays an important role as it reabsorbs the 2/3 portion of filtrate. In which mostly the sodium, potassium, water and glucose are reabsorbed. Only the H plus is secreted. Secretion occurs with the help of carbonic anhydrase, and we will discuss in later on how it occurs, but the 2/3 portion is reabsorbed in the proximal tube. The next part of nephron is loop of Henle. Loop of Henle is again divided in two parts, in descending limb and in ascending limb. The descending limb, only the water absorption occurs, nothing else. Water absorption occurs, and again the ascending limb is divided in two parts, which is first is thin ascending limb and again is thick ascending limb. Thick ascending limb is again divided in two parts, one is medullary portion and one is cortical portion. There is not too much reabsorption occurs in the thin ascending limb, but in the thick ascending limb, in the medullary part, co-transporter is present, which is known as sodium potassium 2 chloride co-transporter, which absorbs the ions sodium, potassium and chloride, but this part is impermeable to the water. And the next part is cortical, in which symporter, sodium chloride symporter is present, which as usual reabsorb the sodium and chloride, but again it is impermeable to water. So according to diuretic point of view, this part is very much important, which is thick ascending is very much important. Why, we will discuss later on why it is very much important. And the last part of nephron is distal tubule and collecting duct. Here limited reabsorption occurs. Here the amiloride sensitive channels are present, amiloride sodium channels are present, which causes a limited reabsorption of sodium. And in exchange of that, potassium ions are secreted or effluxed, but there is a limited reabsorption occur of sodium. Other than this, here the aquaporine channels are available. You all know that they work in the influence of ADH. If ADH is there, more water is absorbed or more aquaporine will work, and the opposite is vice versa. So these are the parts which are responsible for the urine formation. Now, understanding these parts and their role, you must are thinking that the diuretics which are acting on the proximal tubule will be highly efficacious, because the 2/3 portion of filtered is reabsorbed. If we stop this reabsorption, more and more sodium and water will be excreted. But it is not. The drugs which are acting on proximal tubule are not a good diuretic. The reason behind that the drugs, if are acting on proximal tubule, they decrease the reabsorption, but due to the compensatory mechanism of distal parts of loop of Henle, distal tubule, collector, they again regain the same water content in the body. Other than this, the agents are weak, which are acting on proximal tubule. The example is carbonic anhydrase inhibitors. We will discuss later on. So the drugs which are acting on proximal tubule are not good or efficacious diuretics. Contrast to that, the drugs acting on thick ascending limb, where the most of the ions are absorbed with the help of the channels. If the drugs act on these portions, they are good efficacious diuretics, because there is no chance of compensatory increase of reabsorption distal to that part, because most of the reabsorption has already taken place before this portion. So you will see that the most of the drugs or diuretics act on these portions of this thing is medullary and in cortical part. And the drugs which are acting on the distal tubule and collecting duct, they are very weak diuretics, because they have a limited reabsorption which will be inhibited. So this is how you can understand the nephron parts and urine formation. Now we will take the drugs which are included in diuretics. Now we will discuss the drugs which are included in diuretics or used as a diuretics. The drugs of diuretics are divided or classified according to their efficacy. In this, the drugs which have high ceiling or high efficacy are included in this category. The second is moderate efficacy, and the third is the weak and adjuvant diuretics which have a weak efficacy or low efficacy. In this category our drugs are classified. So first we will discuss the high ceiling or high efficacy diuretics. As the name suggests, they have a weak efficacy in this group, and the prototype of this drug is furosemide. The key points regarding this furosemide is that they are high efficacious. They can increase the urine volume up to 10 liter. Up to 10 liter urine volume can be prepared or can be caused by this high ceiling diuretics. Other than this, they are useful even in severe renal failure, or you can say these are the only diuretics which are useful in renal failure. So, other than this, they are vasodilatory in nature. They increase the venous capacitance or vasodilatory in nature. Other than this, you can say the disadvantage of this, that they start a compensatory mechanism in body, due to short half-life. They have a short half-life, so they increases the urine volume and the total volume of the body is decreases, but soon after their action is finished, the body starts a compensatory mechanism with the help of renin angiotensin system, you are aware, and again the volume is re-established after some time. So they does not decrease the volume or blood pressure for a long time. That's why they are not a good antihypertensive in long-term durations. Long-term duration, we will discuss this also on later on. Other than this, they increases the calcium excretion and decreases the uric acid excretion. So these are the key points regarding the furosemide. Now the mechanism. As we have already discussed that they work on sodium potassium 2 chloride co-transporter, which is present in the thick ascending limb and in medullary portion. They inhibit this co-transporter and increases the sodium potassium chloride excretion in the urine. As they work in on the Henle loop, that's why they are known as also loop diuretics. They can be given oral as well as IV. They can be given in both ways. So, other drugs in this group other than furosemide is bumetanide. Bumetanide is more potent than the furosemide. It is 40 times more potent. And it has much more oral bioavailability than the furosemide, so they are much more beneficial in CHF patients in which the bowel inflammation is there, so they have a good oral bioavailability in the CHF patient. Other than this, the torsemide is there, which have 2 to 3 times more potent. Two to three times are more potent. Again, they are very helpful in the CHF patients. So in this group, furosemide, bumetanide and torsemide are included in this group. Now we come to the uses of this group. They are very widely used in clinical situations. First use and very foremost important use is edema. As they decreases the volume, blood volume, they are helpful in any kind of edema. It can be renal, it can be cardiac, in any kind of edema. Even they are very helpful in resistant edema. Resistant edema and edema in presence of renal failure. These are the only drugs which are helpful in the edema which are present in the renal failure condition. So they decrease the volume and help in the edema conditions. The second important is pulmonary edema, or you say it is acute LVF. They are very helpful in acute IVF or pulmonary edema because of two reasons. First, they are vasodilatory. So, they decrease the venous return. They decrease the venous return before the diuretic action. The second is the diuretic effect, through which the blood volume decreases and they relieve the pulmonary edema or they are helpful in acute IVF. They are very much helpful in acute IVF. Third, they are a limited role in cerebral edema also. Though osmotic diuretics, mannitol are very much useful, but furosemide is also included to support these in the cerebral edema. The fourth use is hypertension. They are very much useful to decrease the blood pressure in a very short duration of time. So they are useful in the restant or emergency hypertension, hypertension in conditions of renal failure. So they are used in special situations. But in a normal individuals, they are not a good antihypertensive, because we have already discussed that they have a short T half, and as soon as the duration is finished, the compensatory mechanism increases the blood pressure again. So they are not a very good hypertension in normal conditions, but they are very much helpful in the special situations like we have discussed. Other than this, volume overload conditions, like where the blood transfusion is required again and again. So to relieve the volume overload, furosemide is given. And the last use is malignancy, hypercalcemia, of malignancy. In some malignancy condition, the fluid depletion occur and which causes the hypercalcemia. So a high amount is infused, but to prevent the volume overload, after that, the furosemide is given to prevent the volume overload, and at the same time, as we have discussed, it increases the calcium excretion also, so it will really help to relieve the hypercalcemia of malignancy condition. So these are the important uses. Edema is there, pulmonary edema is there, cerebral edema, limited role in hypertension, and then these are the miscellaneous uses of diuretics. The next group in diuretics are the medium efficacy diuretics. As the name suggests, they have a lower efficacy than the high selling diuretics. In this group, the drugs are thiazide and related diuretics, which works as a medium efficacy. The mechanism of action, we have discussed that the thick ascending loop, in the cortical portion, there is a sodium chloride symphoter. They inhibit this symphoter and increase the excretion of sodium and chloride in the urine, and with this the water excretion is also increased. Other than this, they, in contrast to high efficacy diuretics, they decreases the calcium excretion. High selling diuretics increases the calcium excretion and they decreases the calcium excretion. Other things are almost similar, so they are the medium efficacy. The drugs in this is, first is hydrochlorothiazide, which is very commonly used in the treatment of hypertension, and it has a duration of action around 6 to 12 hours. And then the drug is chlorthalidone. The duration of action is around more than 40 hours. So they are exclusively used in the treatment of hypertension. Other than this, the drugs are metolazone and zipamide. Metolazone and zipamide are drugs which are little bit similar to the loop diuretics because they can work in the conditions of limited renal failure also. So sometimes they are adjuvant or supported with the furosemide in the conditions of renal failure. So in this way, they can be used. These are the drugs in medium efficacy which are used in renal failure conditions also. Now the recently developed drug is indapamide. It has a unique feature that it has a very little diuretic activity, low diuretic activity, but it is a good antihypertensive because it has a vasodilatory action. So due to the vasodilatory action, it has a good antihypertensive, but it doesn't have the side effects or adverse effects which are due to diuretic activity. So it can be used as a good antihypertensive. So these are the drugs which are included in this group. Now we will understand the uses of this group or thiazide or related drugs. The first and foremost use is the treatment of hypertension. It is very commonly asked in exam that why thiazides are a good antihypertensive compared to the high saline or furosemide. So the answer will be that they have a long half-life. They have a long half-life, so they doesn't allow the body for the compensatory mechanism, and though compensatory mechanism works, but after giving a few days, a net deficient of the sodium content and water content acquired by the body, and the overall blood pressure decreases, which remains sustained for a long duration. Contrast to furosemide. So that's why due to long T-half and they doesn't allow body for the compensatory mechanism, they are used as a good antihypertensive in normal individuals, not in special conditions. Other than this, they are used in edema also, though they are not so much effective like the furosemide in edema, but they can be used in the maintenance therapy. Maintenance after giving furosemide, for the maintenance of treatment of edema, they can be given for a long duration like that. Other than this, though they increases the urine volume, but paradoxically in diabetes insipidus, a condition in which the urine volume is increased, but paradoxically it is useful in the diabetes insipidus, which is nephrogenic type of diabetes. It is used. We will discuss later on regarding this also, that how they are useful, and sometimes they are useful in hypercalciuria. As we have discussed that they decreases the calcium excretion, so sometimes in condition of hypercalciuria where stone formation occurs in urine, they are used to decrease the calcium excretion and help to relieve the hypercalciuria condition. So in this way they can be used primarily as antihypertensive, then in edema and maintenance therapy, in diabetes insipidus and hypercalciuria. So this is all about to the thiazide diuretics. Now we will discuss in the next lecture about the adverse or side effects of the diuretics and the few weak diuretics also. Thank you.